Types of dementia and their causes. Many people think dementia is only about memory loss, but in reality, some patients forget their own children, become aggressive, wander outside the house, see things that are not there, refuse care, or even become dangerous without meaning to. And one of the hardest truths is this: families often think the patient is being difficult on purpose, but many behaviors are actually symptoms of dementia. Today, I will explain the main types of dementia, how each type is different, and practical ways families can care for patients in real life. This is not just theory, this is practical caregiving that people can actually use every day. What is dementia? Dementia is a condition where the brain slowly loses function over time. It affects memory, thinking, emotions, communication, behavior, and daily life. There is more than normal aging. For example, forgetting to turn off the stove, getting lost, forgetting meals, accusing family members of stealing, or not recognizing loved ones. These are serious signs. Type 1, Alzheimer's disease. Alzheimer's is the most common type of dementia. Common symptoms: forgetting recent events, repeating questions, losing items, confusion, getting lost, difficulty remembering names. For example, a mother asks, "Did I eat already?" Her daughter answers kindly. 5 times later, the mother asks again. This happens because the brain cannot store new memories properly. Practical care for Alzheimer's. 1. Do not agree with the patient. Many caregivers become frustrated. They say, "I already told you," but agreeing usually makes the patient anxious or scared. My suggestion: answer calmly and simply. Even if you repeat yourself many times, the patient is not trying to annoy you. The brain truly cannot remember. 2. Create a safe environment. Practical examples: lock dangerous doors, hide sharp objects, keep the floor clean, label rooms, use night lights. Many dementia patients fall easily or wander away. Safety matters more than perfection. 3. Keep a daily routine. Try to keep meals, sleep, bathing, and medication times consistent. Patients often feel safer when life is predictable. Type 2 vascular dementia. This type happens because of blood vessel problems in the brain. It is common after strokes, high blood pressure, diabetes, or poor circulation. Symptoms: slow thinking, slow walking, emotional changes, confusion that comes and goes. Some days the patient may seem normal, other days they may struggle badly. Practical care for vascular dementia. 1. Control medical conditions. This is extremely important. Families must monitor blood pressure, blood sugar, cholesterol, medication schedules. Without control, brain damage may worsen faster. To encourage movement, many families let elderly patients stay in bed all day. This often makes decline worse. Simple activities help: short walks, stretching, moving arms and legs, sitting outside. Movement supports both the body and the brain. Type 3 Lewy body dementia. This type is less understood. Symptoms may include visual hallucinations, confusion, sleep problems, strong emotional reactions, shaking, or stiffness. Example: a patient says, "There is a man standing over there, but nobody is there." To the family, it seems imaginary, but to the patient, it feels completely real. Practical care for Lewy body dementia. 1. Do not aggressively deny hallucinations. Avoid saying there's nobody there. This can increase fear. My suggestion: respond calmly. For example, "I'm here with you. You are safe." Sometimes emotional reassurance works better than logic. To prevent falls, patients may have balance problems. Practical ideas: remove slippery rugs, improve writing, use stable shoes, assist during walking. One fall can seriously change a patient's life. Type 4 Frontotemporal Dementia. This type often changes personality and behavior first. Symptoms: rude speech, aggression, impulsive behavior, emotional changes, lack of sympathy. Families sometimes think the patient became mean, but often the brain regions controlling behavior are damaged. Practical care for frontotemporal dementia. 1. Stay calm during emotional situations. Fighting emotionally usually makes things worse. My I recommend short sentences, calm tone, simple instructions. Example: please sit here, let's calm down first. Simple communication often works best to protect caregiver mental health. This tie can emotionally exhaust caregivers. Many caregivers cry secretly, lose sleep, develop anxiety, or become depressed themselves. Caregivers also need support, a reality many families do not talk about. Dementia does not only affect the patient, it slowly affects the whole family. I have seen daughters crying for exhaustion, husbands losing hope, sons becoming emotional burned out, caregivers feeling trapped and alone. Caregiving is not a one-day challenge. It is a long emotional journey. Practical advice for caregivers: 1. Do not try to carry everything alone. Ask family members for help. Even small help matters. 2. Rest whenever possible. Even short breaks are important. A tired caregiver cannot provide good care for long. 3. Do not feel guilty for feeling tired. You are human. Caregiving is emotionally heavy. Feeling exhausted does not mean you are a bad person. My opponent, I believe dementia patients need more than medicine. They also need emotional safety, patience, calm voices, and people who understand them. Many patients may forget names, but they still remember feeling. They remember fear, anger, kindness, safety, and emotional energy. The way we speak matters. What families can apply from me: families can apply calmer communication, safer environments, daily routines, emotional patience, and caregiver self-care. These simple things often improve daily life more than people expect. Benefits viewers can receive after understanding dementia better. Families may reduce conflict, improve communication, lower caregiver stress, prevent dangerous situations, and feel less emotionally lost. Knowledge reduces fear, understanding creates patience. My final reflection: sometimes caregiving is not about bringing the old person back. Sometimes it is about learning how do we stay beside them with understanding, even while the disease slowly changes them. And sometimes the greatest thing a dementia patient needs is not perfect words. It may simple be someone who still stays beside them. Thank you very much.